Hello, my dear audience. I'm Peter Reznik, and welcome to the Dr. Peter Reznik's Toolbox. Thank you very much for those of you who wrote to me with your comments about my latest several shows and suggestions for those shows yet to come. As I promised, I will be putting all those suggestions that you send me together and organize them in the way you suggested. Also, if you're interested in me inviting for an interview a particular specialist in the healing arts, please write to me, and I will do my best to have this person on my show. Again, my email is drpeterresnik@gmail.com. Of course, not everyone is easily available, but so far I have been very fortunate. Next week, I decided not to talk about one of the tools I utilize in my practice, but about one of my programs in which I utilize all the tools that I know. And this program is about self-discovery and self-mastery. I will begin to slowly share with you parts of the program, of course, those parts which are possible to introduce through the medium of a radio show. And a week after, I will have here an interview with the neuroscientist, Dr. Andrew Newberg, professor in the Department of Integrative Medicine at the Thomas Jefferson Hospital, University Hospital, Philadelphia, and the author of the book, How God Changes Your Brain. Today, I have a very special guest. But before I introduce this guest to you, I want to share with you something personal. By the grace of God, at my younger age, I spent a lot of time with two of my nephews, one from my brother, son of my brother, and one the son of my sister. At some stage in each of their lives, I played somewhat a role of their mentor. Since then, both of them surpassed me greatly and became my teachers. Both grew up to be extraordinary men and masters in the healing arts. In fact, I credit one of them, along with my sister Ina, for saving my life during my 2 weeks encounter with the COVID-19 in last March. But I invited him today, that is, I invited Dr. Oleg Reznik, not because he is a wonderful physician, but I believe he is. And of course, not because he has been my long-distance, loving and supportive doctor, but because 10 years ago, he had the courage to write a book, Secrets of Medical Decision-Making, How to Avoid Becoming a Victim of the Healthcare Machine. Here is what Reverend Dr. James Clifton wrote about this book. The Secrets of Medical Decision-Making awakens the reader quickly with a startling revelation about the lack of seriousness in the healthcare industry toward a society of wellness. Patients in today's society resemble an assembly line as they are pushed through the healthcare system that is set up to serve and protect the medical industry at the expense of the patient's health, safety, and welfare. If this book at least motivates its readers to become more involved in medical decision-making when seeking treatment, it will have succeeded in a critically needed public service. Ladies and gentlemen, I think today this book is more relevant than ever. Here is some statistics. According to the recent study by John Hopkins, more than 250,000 people in the United States die every year because of medical mistakes, making it the third leading cause of death after heart attack and cancer. And that is why I'm introducing to you today Dr. Oleg Reznik. Hello, Dr. Reznik. Oleg. Hi, Oleg.
Yeah. Hi. Can you hear me, Peter?
Yes. How are you?
Good. Thank you for giving me a speak about it. We have, as mentioned before, we're having a snowstorm in Maine, and even the phone signal flickers sometimes. So if you lose a connection, I did leave a backup number, but it might happen. It's just weather conditions.
Okay. Thank you very much for finding time. I know we will try to arrange this meeting for a while, and you are very busy in your practice. And before we start talking about the book, would you please, Oleg, tell my listeners, our listeners, about yourself and your practice as a physician?
Sure. So I came to the U.S. From Odessa, Ukraine, in 1988 at age 18. I went to New York University for undergraduate degree, SUNY Downstate for my medical degree, SUNY Stony Brook for family medicine residency program. And I've had other interests, psychological, spiritual interests along this path. And the book that Peter is mentioning, I actually wrote 15 years ago, 2005.
15?
It was published.
I thought 10. Yeah. Sorry.
Yeah. It was published in 2006. It was written in 2005. And the book has some ideas and concepts related to the use of healthcare, as well as a lot of research and statistical data that I put together that was pertinent at that time. And most of it is still the case, even the statistics, some of it has changed 15 years down the road. And the book, I wouldn't want the book may have had that sense of being kind of antagonist to the healthcare, but it's not my intention now to have that kind of a perspective. The healthcare system, I hope really to present a more balanced view. It has its uses, but also it has important parts that are, counterproductive to health, and it would be useful to recognize both sides.
Mm-hmm. What, if you don't mind saying, I will ask more questions specifically about the book, but what made you decide to write it then? There is always a catalyst to anything that people choose to do. And then if you would be writing it now, how much of it would you change? It's kind of double question.
Sure. Yes. So that's a very good question. At that point, I would say there was a component of frustration in me in trying to practice the way that the demand was, on me to practice after residency. This is the first couple of years after I finished residency, and I was in a type of clinic that was a federally subsidized clinic, high volume, and to try and put it together for myself. How is this possible to, truly promote health and at the same time to work in the place where I was working? Is this possible? What were the problems? And it took years for me to really find a way. And the way I found is to find a job where I work now, where I'm able to see a lot fewer patients per unit time than a normal doctor would see. And now it is possible for me. I feel, I would say, fulfilled as a physician. Concordantly with that, in writing a book, if I wrote it now, I think it would be less confrontational. At that point, I was at a stage of my life where I felt very much uneasy about my place between the conventional practice, daily grind of medicine, as they used to say and still do, and my perspective on what are we really doing? Are we genuinely helping? Or how much are we causing?
With age, we all mellow down a little bit. And but last week I interviewed here on PRN a big troublemaker, psychiatrist, Dr. Peter Bregan, who went against the opinions of medical establishment and got then himself in a lot of trouble. When you were writing then, were you concerned that you will have problems? Because once we start talking about the book, were you concerned that there will be some kind of backlash?
So yes, I was. I was willing to take some risk. I was at that point exploring the option of leaving conventional medicine altogether and trying to be an alternative doctor, so to speak, which is not the case now. Now I feel like myself well integrated in both aspects of things. But at that time, there was a little small backlash in the sense that the hospital where I was working at that time, the librarian found out that I had the book published, wanted to put it into a hospital library. She asked the physician executive of the hospital if that was okay. He looked through the book and said it was not okay and that whatever this doctor wrote was rubbish and so on. So there was a small backlash because the book was, it didn't make big, so to speak. So it was, if it did become something, very popular, there would be probably an enormous backlash. So I was fortunate that then.
Mm-hmm. So let's now start talking a little bit about the content of the book. So, is there something you would like? Do you still remember what you wrote in the book? What my first question will be: what is the best way today for patient to approach medical decision making? What one may need to consider to make medical decisions?
Yeah, so that was the question for me when I wrote it, and it's something that I keep rethinking as time goes, and it hasn't changed enormously from the time that I was writing the book. When I wrote it, the foreword was written by my former program director, Dr. Kopiskor, who was a physician in academic medicine and had also a JD, and was an attorney in addition to being an MD. And he wrote in his foreword, it was from the show, I think the show was from the 50s or 60s perhaps, it was a popular show of a physician, family physician in a small town, who would find a relationship between the person's illness and the social predicament that they were in. Each episode was like that. It was pretty fascinating that people, have had that idea and put the show together specifically to illustrate this, how everyday events and interactions and conflicts play into health and illness. But the part about your question about what's the best way to approach it, it's I would say it's somewhat complicated questions in the sense that it has a couple of components in my mind. There is a component about information, just having information about the capabilities of healthcare system, how it works, what it's good at and what it's not good at. And then there is the other big component, which is the personal attitude or psychological state, which has to do with how one interacts with this healthcare system. And so those components are worthwhile. And while the capabilities can be discussed fairly briefly and one can just read something and learn, the personal attributes that, as in psychotherapy, I suppose one could say, when the patient comes to see the psychotherapist goes not only by what the patient tells him, but also the patient brings himself to the psychotherapist. The psychotherapist can see, by the way the patient interacts with him, what's going on. So it's similar in that sense that the patient brings himself to the interaction with the healthcare system. And if the patient is anxious or any number of other psychological or other states, spiritual states, that also has an impact on what happens.
Mm-hmm. But you know, Oleg, I don't know. I know you so well, but I actually never asked you if you were ever hospitalized in the last, since you came to America. I don't think so, right?
No, I've been to emergency rooms a couple of times with some acute problems, but so far, no, I have not been hospitalized.
Well, but look, I am in the health field, but I remember being 14 years ago hospitalized, and I did not have any thoughts about statistics, how to be. I was just like feeling scared. Maybe I'm one of those few people who get scared, but I assume I'm not the only one. Scared and totally feeling at mercy of the doctors. So if you could somehow help me and our listeners to say, okay, when this and this happens, look for this and this. Because frankly, when I read these statistics, 250,000 people die, not because of the illness that brought them to the hospital, but because of mistakes they make. That's very scary. So yeah. What if you could say, okay, if you are brought to the hospital or you go to the hospital for an emergency, think of A, B, C, the steps that you can make or think.
Okay, so you're asking kind of a basic, simple answer, something that one can kind of hang on to and approach the situation. So I could try and answer that way. So first I would say, if your question is about the hospital, the best way, of course, is to try and avoid the hospital to begin with. And you avoid the hospital not at the expense of your own health, but by trying to assess the situation. Do I really need to be in the hospital? So when something happens, it's usually most of the time people are hospitalized from the emergency room. Occasionally their doctor can directly admit and hospitalize people. Most of the time it's the emergency room. So when people come into emergency room, they obviously felt that it was an emergency. The person who is evaluating them, the doctor, that's the person that one could ask the questions. For example, how important it is for me to be in the hospital? Is this a condition that could be managed under optimal conditions at home? Just asking that question.
That's a very good question. Wow. Yeah. Okay.
Just asking that question will open up possibilities. Why? Because one of the realities of healthcare system is the doctors, are under scrutiny. They have to not make mistakes. Emergency room doctors are being rated for the rate of readmission, so they are under pressure for that. Make sure that the person who's been to the emergency room doesn't come back. There are statistics kept on them. So they're worried about being sued if something goes wrong. So if the patient feels anxious, the doctor may often assume that the patient would rather be in the hospital. On the other hand, if the patient is asking the question, is this something that under any kind of circumstances, is it possible to manage it at home, then so by asking that question, whether you can manage whatever is happening at home, this would be one opportunity. If it cannot be managed at home, then you have to get admitted and proceed further. Now, proceeding further, I would say...
I'm sorry for interrupting you. Maybe I need this order. I just want us to repeat. So this, because I loved what you just said, the question to ask admitting physician. So please make a note, because I'm making a note for myself. Not that I'm planning to go to the hospital and I have you all, thank God. But it's a very good point. I never thought about it. I never thought of asking this question. So probably many people could benefit by just making it a point. Thank you. So we got the point one. Okay, next.
Yes, yeah, sure. So, and then I would say, the second point would be actually to turn toward yourself, your own state of mind, and see, just to become aware of how distressed or at peace you are. So it's just the perspective of awareness. It's very important, I feel, even though we're going, away from the mechanics of usual healthcare and into psychology and maybe other fields, but without that awareness, things will come out the wrong way. If you're not aware that you're feeling very anxious, that you're panicking, or maybe you're angry or upset, whatever is happening, then the thoughts that will come out that are related to that feeling, and they will be counterproductive. So, for example, if the person is very anxious, they will start speaking to the doctor in the anxious way, and they will suggest to the doctor the anxiety-provoked thoughts. Oh, could I die from this? Could things go really bad? Could something bad happen? Now, the doctor is just another human being, and by you suggesting those thoughts, they are affected by them. That's one side of it. The other side is they're also worried. They don't want you to be upset at them and, write a bad review to the hospital or sue them if something doesn't go wrong. So the anxiety-related thought on the side of the patient provokes a type of anxiety on the side of the physician, unless the physician is really a master of his mind of a great degree, which is rare. And so, I can say for myself, I haven't reached great mastery. When the patient is very anxious, it does reach me. I'm at least aware of that. And so then you will get all kinds of unnecessary.
I don't think that anybody ever, or too many people think about it, that they will make the doctor anxious, and therefore it may adversely affect the whole healing process or healthcare can be affected by his or her own anxiety. This is kind of incredible to consider.
Yeah, I think that's definitely the case. On a small scale, I can tell you, last week I had a patient, he came in, had something, since I'm not naming any names, I think I'm not breaking any confidentiality, but the patient had something on the food. I looked at it. To me, it was fairly obvious that it was a wart, but the patient was very anxious, said, no, but can you tell me definitely that it's not a basal cell carcinoma? And I thought about it, and not really. I couldn't tell with 100% certainty. Maybe I could tell with 95 or 98% certainty. So we ended up going and doing a biopsy. I took off a piece of skin. He has a wound that now has to heal. It came back. Yes, it was a wart. So that's just a small example, but it happens on a large scale as well, where people get major things done to them, provoked by anxiety.
Something came to my mind now. I remember you and I spoke many years ago, and maybe it's regarding you writing this book. But you told me once that people sometimes, because they want to impress the doctor or to show that that they're not alone there, that they have a good support system, they say to the doctor, my son-in-law, and it can be very much true, but my son-in-law, my best friend is a physician. And you said that's not a good idea. You remember saying this? And why?
Yes, I do, yeah. Because so it depends. Each circumstance is different, and somebody could say, my son, mother-in-law is a doctor, just kind of as a means of being friendly and trying to relate. But often it's not the case. Sometimes it can be also in the same way as people use name dropping, to kind of increase weight or importance to themselves. They are scared, and as a doctor, I understand that. So because they are scared, they want to motivate the doctor to do, quote, a good job. And they are using the same tools that they have used in all other domains of their life. So if they're used to using pressures of different kinds, fear tactics, scare tactics, they will do the same with the doctor when they encounter healthcare system. Only here they are at a big disadvantage because they don't know how much trouble this can get them into.
Would you now specify, because I know what you how you answered, what kind of trouble would it get a person if this person says, I have this chief of staff, in this hospital, it's my son-in-law. How would it make the doctor feel, and how would he possibly act versus if he would not hear this?
Yes, so the most health-promoting attitude for a physician, I think, is that there is a genuine feeling of caring for the human being that's in front of you. They have to be caring, and then there has to be also competence. They have to have certain knowledge and skills. When someone is being threatening in various ways, whether it's openly or in subtle ways, the caring, unless the doctor, again, is very kind of an evolved being, the caring is very quickly substituted by defensiveness. Suddenly the doctor thinks, so somebody else is going to check and scrutinize everything I do. If things go wrong, they will point that out. I will be blamed, perhaps sued. There's huge implications. I'm going to take the safe path. I'm going to do all the tests, whether they're needed or not, but extra testing. Doesn't matter if it's expensive, invasive, painful, no matter. We'll do extra tests. We'll do extra consultations. We'll bring a couple of consultants on board so that if things go downhill, there'll be 5 other people who will be sued. So it will be much more difficult to say, this one guy messed up. These are just some of the scenarios, but unfortunately, it's a reality. I have seen this happen, many times. When I was in the hospital, particularly during residency, but in other times as well.
So let's go with any other advice you can give, whether it's from your book. Let me actually stay a little bit more on your book, and then I will ask you questions beyond the book. So what else did you stress in the book? What are the secrets of medical decision-making? And most important, what conclusions must our listeners make, and how they need to alter possibly the choices that they make? You can speak, you can choose whatever subject you want to cover from your book.
Sure, yeah. And so I would like to cover a couple of subjects here. As far as, reference to secrets was reference to the components of medical decision-making that people don't often recognize, that, the physician is just another human being. And yes, I think most of them did go with good intentions, went to medical school wanting to be helpful to other people. Started out in medicine and continued trying to do something helpful, but then they were put under a lot of different pressures that are not always health conducive. The financial pressures of productivity, they are told they have to see this many patients per unit time, whatever it is. So there are some things that they will not be able, you cannot do in a limited time. And so there will be a bias to just put people on medications, for example. This is one bias, that people, once they learn it, it's very difficult to unlearn. They will, when you somebody comes in with, let's say, a mild form of diabetes, you can have a discussion with them, trying to motivate them and describe them the relationship between the level of activity, the quality and quantity of the food that they eat, their mental state, and the diabetes, and how you could, with changes, you could assess their specific dietary pattern, physical patterns, and then come up with a solution, a proposition at least, of something that would individually work for them. Some small changes to start with, and then continue that would be individualized and over time perhaps gain traction. But there's no time for that. So if someone is diagnosed and as a physician you're scrutinized and asked, did you provide appropriate guidelines, according to the guidelines, appropriate treatment? So there is an algorithm of what medications you can put the people on. So there is that bias of intervention because it's something quick. You can write a prescription, come back in whatever amount of time, and keep going. That's one of the secrets in the sense that the patients and sometimes the physicians are not fully aware of that there is this dynamic. And then there is the litigious component of it, of worrying about the lawsuit. Currently there is a pay for performance or accountable care organizations that have sprung up, where they collect different statistical data on each individual doctor or patient panel. How are their blood pressures, blood sugar levels, numbers of percentage of people with mammograms, with colonoscopies, whatever, things like that. And you're compared to others, and you're given these statistics essentially to pressure you to keep up with the rest, with what is called standard of care. And so when there are,
I didn't realize that.
Yeah. So with all these pressures, it's quite a challenge. It's a challenge to really address, health in a way that health truly is something that the person is able to transform in their life and change the way that they are living, change from their physical level of physical exercise, the diet that they have, the exposure to toxins, the intake of addictive substances, the psychological or mental health. Those are the things that bring health that are not really. There's a bias against addressing those at the usual healthcare visit. So that's one side of it. The other side is just basic information, and the third side is the attitude of the person. So the basic information would be that for a healthcare system that we have now is very good for acute, severe conditions like major injury, broken bones, motor vehicle accidents, appendicitis, anything that's acute and life-threatening. The healthcare system now is very effective and should be utilized. Mm-hmm. If it's so that's obvious, and there should be no hesitation, I think, to utilize it, as long as you've established that that's what's happening, that you're having really a major acute life-threatening event. If it's not an acute, if it's a chronic life-threatening event, there is more time. So one can, if it's something that's chronic, somebody comes in and they have colitis. Let's say they went to the bathroom and had the bowel movement. It was full of blood. They went to see the doctor. Doctor tells them it's colitis. Colitis can be life-threatening, but the doctor will tell you also that it's a chronic condition. It probably took at least weeks to get to where it is now. So there, you could start the conventional treatments if it's a particularly bad situation, but one can explore and should what one can do to optimize his or her health otherwise, and in a more natural way contribute to the body's capacity for healing. So those are the things to kind of try to see as far as what's happening. Acute versus chronic, major versus minor condition. For minor conditions, sore throat, a lot of people won't go to the doctor, and rightfully so.
Mm-hmm. I have this next question, and it's kind of, I will contradict myself a little bit. I am for, and always have been, for kind of looking to resolve your problems without doctor's intervention. And my question is, how much should you take upon yourself to make up your mind? Because I have this incident, and you probably remember from my life, some 15 years ago, I had a condition where I needed to have an ablation. It's WPW, right? It's
yes,
where they have to literally go to go inside of your body to reach your heart and shave off a little piece or whatever.
Yes.
You can explain better, probably, right?
Sure.
But it was a condition that had to be taken care of. It doesn't happen with many people. I think it's 1 of 1,000 or what's the statistics? And nevertheless, thankfully we have now perfect medicine for it, and that's called ablation, where they do go with a laser, with a camera, and they shave it off, and the person is, in fact, 100% well and doesn't even need to go after a while to see a doctor. They're fine. But the reason I'm telling you this story is because when I was brought to the hospital, and I remember Dr. Kadacha was a sweet, sweet woman. She did some tests, and she said, we'll have to do ablation. And she explained to me what it is. And I said, wait. You doctors, you want to rush always to do surgery? No. I'm refusing. Let me think about it. I will think about alternative ways. And she said, Peter, you can think, but meanwhile, I will begin to prepare for the surgery or whatever it was called. And she was right. I was wrong. On the other hand, the reason I said I will contradict myself is because, unfortunately, I don't remember what university did the study, but I actually remember reading about the study where people who discharged themselves against physicians' advice from the hospital, and these people were followed for a certain time, and they found that 88% of these people were right. So, but if I would be one of those people, I would be one of those 12%. So on one hand, yes, I say, yes, that's a good idea to rely on your own opinion. On the other hand, what if you're really wrong and you are among these 12%? How do you decide? If you get a headache or you have some tingling, you're a physician and okay, it can come from this and this and this. But people are, look, I'm in the health field, but I do mainly psychology, mind, body, but I do not know all those little details that you know. How does a average person make decisions like this?
Sure. So how would be? So first, I would like to say that on subtle issues like what you described, there's not necessarily a right and a wrong answer. It depends on each individual person, their preference, and we cannot know up front if this will be the right thing or the wrong thing, just like we don't know the future. So there are things like that in healthcare for which there isn't necessarily just one right or one wrong answer. For example, let me give you an example with your own situation that you just described. Yeah. Wolff-Parkinson-White syndrome is an accessory pathway in the electrical conduction of the heart, which creates an environment that if the heart rate is triggered by some additional arrhythmia, a condition that promotes a rapid heartbeat, normally when the electricity goes through the right pathway, not the accessory pathway, but through the correct pathway, there is a natural slowing down. It's like a protective mechanism that will prevent extremely high rates of heart rate, which can be, at worst case scenario, can be deadly. Usually it's not deadly, but the person may pass out. If it happens frequently, they may have remodeling of the heart tissue and permanent damage. So you can have really serious consequences. Right? At the same time, not all people with Wolff-Parkinson's White need to have an ablation. This is often found incidentally on the electrocardiogram. There are signs that this exists. And you can have a person who is very calm, who doesn't get the triggering events, so they will not have the other conditions that will trigger rapid heart rate, and so they will not be in danger. They can have a long life, live 100 years with Wolff-Parkinson's White without any negative consequence of it. To make it even more complicated, there are other conditions where accessory pathways happen, and this is something I just learned recently, and I was just fascinated. As I keep reading, it's just part of like any doctor, you have to keep reading about things, and new things are discovered. And it was found, at least for some of these accessory pathways, that it's a kind of an autoimmune process. Your own antibodies can precisely knock out the correct pathway and create a new pathway, or the electricity will go according in the new pathway as a result of kind of an autoimmune type of response, antibody mediated. So, which tells me that this is a fascinating thing, immune system triggered, and immune system can change many things in the body. So it's like that, just to say how complex it is. How do you make the decision?
Yeah.
I would say the first thing, again, is to become aware of how you feel, your mental and emotional state. Because if you are not aware that you are scared, at least even if you cannot be less scared, let's say you cannot help it, you're scared, at least you are aware. That at least helps with some of this decision making. And then you could wait perhaps till the moment when you're not scared. You can ask the doctor, is it something that's likely to kill me within a week, or do I have a few months? If you get information. If you have some time, I think it's best that you wait until the moment where you have mental peace and clarity of mind. Then you can ask the right questions. Then when you are not in an anxious state, you can ask or write down the questions, how dangerous it is. What is the likelihood that it's going to kill me or cause me a permanent severe problem? What is the likelihood that it won't cause problems? You can ask those questions then, and then each person individually has to make that decision based on their risk tolerance, because we all have different tolerance of risk, and there is no judgment, I think, in my mind, can be made, who is right or wrong about this. I never certainly impose my, risk preferences on my patients. I ask them what they prefer. So when they try to ask me, what would you do? I tell them, it's your life. I'm not making it a secret. I can tell you what I would do, but that's based on my personal bias. You don't have to have the same personal bias. Your personal preferences can be different.
Mm-hmm. Mm-hmm. Okay. Is there anything else you would like to add from that book? Anything else you want to say that you covered in the book, and then we'll go a little bit beyond the book?
I actually did not look back in the book. I moved on. The book, I think, has value. There's no doubt. I put my energy into it, and then I went on after it. It's been 16 years, and now, so no, nothing in particular that I want to add.
Would you, if you were to add now, somebody would ask you to edit the book and maybe to add another chapter, and so it would be published now, what would you add? what else? You learned a lot in these 16 years. Is there, but also to kind of prolong that list that I'm, I'm oriented. I'm Peter Reznik's Toolbox. So yet another tool. What else could you add to our list that people have to remember if they have to go to the hospital?
Yeah, so it's kind of two different questions in my mind. First, what would I add to the book? And to the book, I would say I would add the utility of, I was describing mostly the problems, but, there is a legitimate place even for treatment of chronic conditions. For instance, you take any chronic condition, whether it's diabetes or asthma, whatever it may be, or mental health problems, depression, whatnot. Even though you can address that without pharmaceuticals, without pharmacological therapy, there is a legitimate place for pharmacological therapy. If a person is too overwhelmed, they feel that they are psychologically or not psychologically, according to the habits in their life, what they're used to eating and activity levels, they feel that the changes that are needed are so far that it's in their mind completely unreachable, then there is a value in going on pharmaceuticals. They will at least buy you some time, perhaps, and maybe improve comfort or reduce a little bit the progression, which is all that you can expect from the pharmaceutical, but they can, that still has value. It has a value for, people giving them time so that they could regroup, come up with a strategy, and start working on things in a different way. Mm-hmm. That's the part that I think I would add to the
When you
book
say
now.
Pharmaceuticals, you're talking about psychiatric drugs.
If it's for any chronic condition, so yeah, for example, if it's a psychiatric problem, like bipolar and anxiety disorder are the two most common ones, for those, yes, if somebody comes in and they are, really in a fairly severe state, not necessarily to the point of needing to be hospitalized, but to the point where they don't see how they could do anything psychologically. They're so psychologically overwhelmed that they cannot imagine doing any kind of mental work, even focusing on anything. Then there is a value of medication. It buys a little time. If it works, it helps for the time being. And in the meantime, you develop a relationship with the patient and the trust, and then they can, in small steps, start making other steps that are really, more in line with true transformative healing.
Mm-hmm. Mm-hmm. Yeah, I agree with you. I remember, you probably remember Dr. Blumenthal, Celia Blumenthal, and we worked very well together. And I remember actually seeing a patient who had severe OCD. It would take him 45 minutes to an hour to get out of the apartment, turning off gas, turning on, and so on and so on. And absolutely none of my tools worked. And I'm usually so kind of encouraged. I see a problem, I say, okay, I have the Luvox just for a short time. With the intention, we all knew that the intention was for him to slowly get off the medication once he has the capacity to use the tools that I offer. And it worked beautifully. And he got off medication like within 3-4 weeks of being on this medication. He calmed down. He was able to break the pattern, and then already utilize the technique that I taught him. And then he got, within the following 3 to 4 months, he got off medication. So that's kind of approach you're suggesting, right?
Yeah. Right. Yeah. So to answer the other part where you asked for the tool, the tool for your toolbox. And, if I had to pick, say, like one tool, I would say it would be active engagement or a responsible engagement in your own healthcare, as opposed to, the non-responsible or there are forms of passive engagement that are where the person doesn't believe that they are able to make decisions for their own health, that they could figure it out. They believe that they cannot even imagine that they could be deciding on what's happening to them. And this comes out in a variety of ways, either in a form of denial where people just don't engage and don't see the doctors, avoid dealing with healthcare, or the opposite of that as anxiety, where they are excessively overutilizing healthcare, or passivity, where they just think whatever the doctor says, that's what I will do, and there's nothing else for me to do. There are different other ways that people try to avoid this. And the productive way, I would say, would be to try and engage. To try and engage is to be to accept that you can definitely make decisions about your own health, and you will be asked, by any responsible doctor, also at least for your opinion as far as how aggressive the treatment you're willing to take, or so on, and so not to feel overwhelmed and anxious to the extent possible, but to wait for the moment when your anxiety passed, and then to try and ask questions that don't require much prior knowledge. All you need to do is ask, to establish the diagnosis, the certainty of diagnosis, which also has its own problems. And there are, in alternative fields, as you know, people spoke about actually diagnosis as a problem because you're naming something which makes it more real. But here we're using it for the purpose of trying to understand how severe it is and what kind of prognosis, what the future is likely to bring, so that you can just have an idea and then make an informed decision about it.
You say a person needs to relax and to make decisions when the person is not anxious. Are you talking about using simple techniques that we use, like breathing techniques, or you're talking about really taking some time to talk to the family, somehow distracting oneself completely from making decisions for certain, if this person has time, let's say making a decision, I'm on vacation for this week from my illness, I'm not making any decisions. What would be your advice? Again, yeah, I'm pressing you for a technique. We have few more minutes left.
Yeah, so I would say most of the time this is not the time for the technique, because if it's the situation where you are in the emergency room, or even in the doctor's office, and something is happening that is requiring some kind of a medical intervention, that's a high-pressure situation. And so to try a new technique would not be a good time. If somebody has a technique that has worked for them, yes, this would be the time to use it for sure. I would say in a case like that, that's why I've spoken just about the awareness, because if you are aware, and at least you can be aware that you are anxious, which will be helpful. And maybe if you cannot calm down enough to make a decision on your own, you can call a family member who will help you make a decision.
Well, Oleg, thank you very much for being with us today. It was great to interview you. And to my listeners, again, if you have any questions regarding this show, you can email me at drpeterreznik@gmail.com. Our time together came to an end. Thank you for being with me today. I hope to have your attention next Tuesday. Peace to all who want to live in peace.